We know everything. The Western governments have known this all the time now for 15 months. And the responsibility is, of course, to uphold international law, similarly powerful for white, brown, black, and yellow people. And I think we need to realize that the world, the powers of the world, would never, ever have accepted that 17,000 Jewish Israeli children had been killed in Haifa and in Tel Aviv.
Welcome to the Floodgate podcast, brought to you by the Palestine Chronicle. We are here to engage with today's most pressing issues and unpack them beyond the cliches of mainstream media. I'm your host, Ramzy Baroud, and with me is the brilliant Romana Rubeo, an Italian journalist and the managing editor of the Palestine Chronicle. Let's get started.
Thank you, Ramzy. And with us in the studio is Dr. Mads Gilbert. Many, if not most of you, are, of course, already familiar with Dr. Gilbert and his immense contributions, not only to the humanitarian work in Gaza and Palestine, but also to the conversation on Palestine as well. Dr. Gilbert is a Norwegian physician, humanitarian, and activist with a broad range of experience in international humanitarian work. Since the 1970s, he has been actively involved with solidarity work concerning Palestine. Thank you, Dr. Gilbert, for being with us today.
Thank you so much. Salam alaikum, everyone. And thank you for inviting me all the long way from Norway and to you.
Wa alaikum assalam, Dr. Gilbert. Welcome to the show. If we could just start with your assessment of the current situation, the current humanitarian crisis in Gaza, with a particular emphasis, of course, on the state of hospitals and other medical centers, which have been from the very first day of the Israeli war, the Israeli genocide, the main target of the Israeli military machine. What can you tell us?
Well, I think we need to refocus and not only talk about the humanitarian situation, because it will dim our vision of what is the root cause and the root problem that needs to be solved now. And I say this not to implicate that the humanitarian issues are not important. Indeed, they are critical and vital. But because so much of the West's effort to solve in their way the Palestinian issue is to focus on emergency relief, medical teams, medical supplies, and humanitarian support. And we've been doing that for at least 75 years without coming an inch further with the root cause of all this misery, which is the settler colonial project and the occupation of Palestine. And as a doctor, I am obliged to seek the root cause before I start to try to treat the problem. And if I only look at the types of amputations or the types of diarrhea without critically assessing what caused all this human misery and suffering and losses, I will fail my duty as a medical doctor, because there are few things in a society that is more closely linked than public health and politics, because public health is all a matter of access to water, food, human security, housing, work, education, and of course, freedom to move. And if you don't have these basic provisions, you can have any healthcare you want. You will not be able to obtain any public health. And all these provisions that I just mentioned are limited, if not completely absent in Gaza, which is a man-made, 100% man-made disaster. So we need, before we discuss the humanitarian situation, I think we need to have a conversation on the current political situation in Gaza. And that is very difficult.
Why is it very difficult?
Because we have an extremely fragile ceasefire. And for those who have followed the statistics, the Israelis have been killing, on an average, one Palestinian per day since the ceasefire took power. And they have not been fulfilling the agreement on the number of patients who should be allowed to exit Gaza for treatment abroad. You know, there are 12,000 on the waiting list who need critical treatment that is not available in Gaza. And the daily rate of patients being allowed to pass out was set to 50, and it's not been even that. The number of tents that should be in is far higher than the actual number of tents allowed, and also with provisional housing. So on every aspect of the ceasefire, the Israeli occupation power is actually undermining the ceasefire, which creates a very fragile and dangerous situation. And now, as they're entering into the next phase of negotiations, of course, this can take effect, where tension will rise. And in addition to the difficult ceasefire situation, which of course also is very unbalanced power-wise, you have all these new horror moves by the US politicians, with the President Trump leading on in threatening to take over Gaza, which it sounds absurd, but he is not the clown, and we should be careful not to laugh, because they are completely congruent, these two ambitions, the ambition of Netanyahu and the ambition of Trump to conquer, to annihilate, and to ethnically cleanse the Palestinians out of Gaza. So these are the important questions. And since Ukraine now has taken the center stage, at least in European politics, there is a very high risk that Gaza and the occupation of Palestine and the West Bank, not to forget, is pushed into the shadow, and the Israeli occupation forces and Netanyahu can proceed with his cynical plan to cleanse Gaza of Palestinians and to annihilate and actually annex the West Bank.
And to corroborate what Dr. Gilbert was saying, we reported these days that only 6 out of the 500 heavy machinery that technically should enter Gaza actually entered Gaza. So absolutely the commitment on the Israeli side has been very, not very strong. And in this regard, like the political project that is behind Israeli actions, how do you feel about Israel's constant targeting of Palestinian doctors and medical figures as if they were enemy combatants or even terrorists? For example, according to a statement by the Palestinian Al-Mezan Center for Human Rights, Dr. Hossam Abu Safiya now is detained under the unlawful combatant law. Dr. Abu Safiya, who is the director of the Kamal Adwan Hospital, was detained by Israel last December. He has been detained in the infamous Detention Center, then moved to the Offer prison and systematically tortured since then, according to his lawyers. So what do you think is Israel's logic in doing so? And especially, how can international health institutions confront this legal precedent of targeting, killing, torturing, or trying doctors as militants?
Well, we all know the brave actions and history of Dr. Hossam Abu Safiya. Of course, he's to me a very prominent symbol of the resistance, because the Palestinian resistance against occupation, it's not only Qassam and the other armed groups. The resistance in Gaza and in the West Bank is very broad-based. It's a popular resistance against occupation, consisting of teachers and housewives and fishermen and young people and healthcare personnel, ambulance paramedics, and so on. And they all say, as long as the Satar and the olive trees are staying, we will be staying, to quote one of your famous poets. So the attack on healthcare has to be seen in a wider context, because it is an attack on two elements, which is so important for the resistance. Number one, the infrastructural healthcare, which is a cornerstone for the feeling of safety for the population. And the feeling of safety and the feeling of being able to be cared for in a crisis, in a disaster, and in a war situation, or an attack situation, as I would call it in Gaza, is very important to maintain the spirit of resistance. Say, you have children and you have a family, and there are attacks. Then if there is no healthcare available, you will be much more anxious to take part in the active resistance. And still, I'm not talking about the military resistance. So to have a healthcare is a cornerstone in a society to make people feel safe and to make the families continue to live as a coherent unit. So to destroy healthcare is in a way to attack the inner spirit of the resistance, in my opinion. And what we have seen in Gaza is unprecedented in any modern warfare, if we could call it warfare, because it has been so systematic, not only directly targeting a number of hospitals, but systematically cutting the local hospitals off from the population by bombing the nearby apartment buildings and habitat, destroying the roads, destroying all the supply lines, so that the whole hospitals became isolated islands in a very sort of destroyed desert of the society. And then add to that the systematic targeting of healthcare personnel. More than 1,000 doctors, nurses, paramedics, medical students, pharmaceutical students, and so on have been killed. The majority of those killed being female healthcare workers and nurses. There is actually a higher risk of being killed in Gaza if you are a healthcare worker than if you are a civilian. So that is the other aspect of the attacks on healthcare. And of course, all of this is in contravention to international law. But the second ambition or goal of the occupiers is the epistemicide, that is to eradicate the knowledge of the Palestinian people. And an important part of the collective knowledge in Gaza is what is embedded in the healthcare, not only the hospitals and the primary healthcare clinics and the fantastic paramedic corps they have, but also in the educational system, the medical faculties, the brilliant School of Medicine in Al-Azhar University, the brilliant School of Medicine in Islamic University, both universities, like all the other universities and colleges, destroyed completely. And the Israelis have tried intensely both to kill students and to kill the institutions in order to stop the education of the Palestinian people and to destroy all the knowledge, the research body, the clinical knowledge, the organizational knowledge of the healthcare system, which is so important part of the knowledge base of the Palestinian people. And this, to end, is what the colonial project is all about. It is the politics of elimination of people, elimination of habitat, elimination of knowledge, elimination of culture, and elimination of the existence of a people.
Absolutely.
Absolutely. Thank you for this. I know there is a question. There is a question of priorities here. I mean, where do we get started? Let's not deprive Palestinians in Gaza from the element of agency. Obviously, it's their sumud, it's their steadfastness. It's the resistance in all of its forms, as you mentioned, Dr. Gilbert, that makes them strong and keeps them going. But of course, there is solidarity that comes in so many different forms. Many organizations around the world are mobilizing in support of Gaza. Many healthcare professionals, including doctors, would love to seize the opportunity to make a direct contribution to helping war victims in Gaza. If you could provide a concise and clear instructions, and I know it's not exactly possible to be clear and concise under these horrific circumstances, but just to deal with the questions of what can we do to help in supporting the Palestinians. It's a loaded question, but it could be a starting point for those who want to channel their help and support. And if you don't mind, if you could even provide names of specific organizations that are most credible and most helpful in at this particular stage.
Well, Ramzy, that's a very, very important question. And let me start my answer by reflecting on the word solidarity, because to me, the two most beautiful words in my language is love and solidarity, because these two capacities of humankind are the ones that really brings us through crisis. In everyday crisis, somebody falling off the bicycle in the street, somebody having a myocardial infarction, somebody being abused, or capacity and willingness to stand up for others and provide help and provide support, and our shoulder to support. That is critically important. And when we talk about Dr. Hossam Abu Safiya, there has been a massive international campaign to free him, as you all know. And now I heard the news today, actually, that he is probably going to be freed tomorrow, I heard. If not for the international solidarity, his lawyers would never have been allowed to come to the concentration camp he's in. So let's not forget that the most important thing I do as a Norwegian doctor is not to go to Gaza. It is to work steadfastly in Norway to educate people, to do advocacy, to be a part of the solidarity movement, which is aiming at changing the politics of the Norwegian government. And that's the greatest contribution we can give to the Palestinian people. That is if and when we can change the politics of the Norwegian government to divest, divest all the massive Norwegian pension fund, which is the largest in the world, to make sure that Norway continue to contribute to UNRWA, to make sure that the Norwegian government is very clear in their practical sanctioning of Israeli trade, research cooperation, cultural cooperation, and so on. So we have our homework, I think, is the most important contribution. Then, of course, we may travel, and we may travel to Gaza or to the West Bank as health professionals, doctors, nurses, psychologists, what is it? But my principle, I don't practice humanitarian medicine. I practice solidarity medicine. And number one rule there is don't go if you're not asked to come. Because the relief industry and the colonial aspect of the relief industry, the white savior model, is that we in the global north, we always know what they need. So we just go with our tents or whatever relief and we impose ourselves on them without asking, what do you need? In fact, do you need us at all? Or will we only be in the way? And to be a little bit controversial, I can tell you that several times, quite a number of times, I have been asked by my colleagues in Gaza, and I've been working with the healthcare workers in Gaza for 25, 30 years. And I was there during the attack in 2006, 9, 12, 14, and worked in Shifa and Al-Quds hospitals. So I know them well, they're personal friends. They called me and said, can you try to stop these foreign medical teams coming? Because they need transportation, they consume the fuel, which we almost don't have at all. They need beds and food and water, which is extremely limited. They stay for a short time, take a lot of pictures, do some operations, and go home. And this is an ongoing debate. The relief industry as a colonial element obscuring three important things. Number one, the sovereignty of the affected people. The Palestinian people should be in charge of just everything, defining the need, accepting who is going to come, and be the director of those who come. It should not be like different organizations setting up their tents and headquarters. They should all be under the umbrella of the Minister of Health in Gaza, Dr. Youssef Abarish. And number two, they should not be allowed to define what needs they are going to cover. They should be booked or ordered by the Palestinian healthcare and being asked, can you cover this? Can you cover that? So that they have the full control and the layout of the emergency medical support. And number three, I think, again, that when we look for organizations, as you asked for, Ramzy, I would look again at what Palestinian grassroots organizations are there. We all the northern, all the global north, we think that, oh, it has to be Doctors Without Borders or UNICEF or whatever of these organizations which come from Europe or the United States. And that obscures the fact that there are brilliant grassroots healthcare organizations in Palestine, in occupied Palestine. Take, for example, Palestinian Medical Relief Society, a large non-governmental volunteering medical organization led by Dr. Mustafa Barghouti, who is a brilliant clinician, doctor, also a politician, as you both know, a close friend of mine. They have 75 medical teams on the ground in Gaza. They see around 250,000 patients per month in Gaza. They know the culture, they know the language, they know the families, they know how it is to live under occupation, and they can fit in a way that no foreign team can fit in. So I have changed. I don't give any money to any northern white NGO. I only give whatever we do in fundraising, and we've been doing a lot of fundraising in Norway lately, and we give that to Palestinian Medical Relief Society directly, so that not one nickel is wasted on air tickets, hotel, transportation, per diems, and all that money which is consumed to have an international medical team. Now, let me be clear. I'm not criticizing the individuals who travel, and I've been doing that for myself many, many times. But I am saying that we need a conversation and a discussion on the role of the international relief industry. And it's more important than ever right now when we are going to discuss the reconstruction of healthcare in Gaza. And look, everybody talks about all that is destroyed. Yes, the Israelis have been very efficient in destroying. But half of the hospitals, half of the 36 hospitals in Gaza are operative. Not at full scale, but they are operative. And the list of hospitals that the Palestinian Minister of Health and the healthcare workers and volunteers have been able to reopen is very impressive. And this is not covered in the mainstream media. So you only get this picture of the suffering, begging, helpless, destroyed Palestinian healthcare. I see another picture. I see a strong, mastering, leading healthcare under the very stern and brave leadership of people like Dr. Youssef Abrish. He's a pediatrician. He has been a Minister of Health, I believe, the last 8 years. A fantastic leader. Dr. Sobistjek, I could mention many. And I see a Palestinian healthcare system that have been able to reopen functions in the hospitals only days after the Israelis have tried to destroy them. Take, for example, Shifa. A few days after the invasion, the bombing, and the burning of Shifa, they reopened the dialysis unit in 2 rooms that were not completely destroyed. They cleaned them, they swept them, they cleaned up, and they put in the dialysis machines, and they were able actually to save lives of kidney failure patients in Shifa. The same with the eye hospital was renewed and reopened. The Kamal Adwan was also reopened before the last destruction. El Akhli Arab was reopened. The Nasser hospital, which was invaded and besieged and destroyed, is reopened and functioning. Al-Aqsa hospital has been refurbished and is functioning. So again, why should we come in as expats, white experts, and tell the Palestinians how to rebuild their own healthcare? They are the ones to do it. They should be on the steering wheel, and we should respect their leadership, and we should support the leadership and ask them, what is the best we can do to support your healthcare system now, and how can we provide support for the rebuilding of the healthcare system in Gaza? That is the true anti-colonial and liberative way of putting ourselves as healthcare workers as useful elements for the liberation of Palestine. If we only narrow it to look at the humanitarian aspect alone, we will fail and we will be part of the problem, in my opinion.
It's a brilliant opinion, and the Palestine Chronicle and all the work and research we do. I mean, this is what we have been championing for years. So just hearing it being articulated in such a wholesome and powerful and apologetic sort of way is really quite comforting. I know, Romana, you have a particular follow-up to that question based on the latest journal article produced by Dr. Gilbert and his colleagues.
You wrote an article for the BMC Medicine with other doctors, and I'm quoting here: "The expansion of field hospitals throughout Gaza raises a multitude of ethical and political concerns and should not be promoted as part of any recovery proposal without several important caveats." I found that so interesting when I was going through the notes. Can you explain the principle a bit more to our readers? Because I don't think it's like something that they are familiar with.
Yeah, thank you. Thank you so much, Romana. Mille grazie. And this is exactly on line with the discussion or the answer I just gave. And I am a co-author of this paper. Here it is. It's entitled "Realizing Health Justice in Palestine Beyond Humanitarian Voices." And it is actually a very sharp rebuffing of some of the European plans that have been put forward. And we criticize because we who have authored this, we took part in some important international meetings and discussions in Amman last year, and several European health initiatives which follow this line of the NGO industry by not addressing the root cause of the misery, the occupation and Israeli colonial project, and not at all addressing the leadership of the Palestinians in their own healthcare system and their achievements and the efforts they are undertaking now, and criticizing the lack of vision for solving the root cause, namely the occupation, but only scratching the surface by saying, can we substitute the lack of hospital capacity with more field hospitals organized by different Western organizations? And what we have seen also is that this field hospital strategy has emptied many places, brain drained, so to say, the Palestinian hospitals in Gaza. Some places there were field hospitals next to a hospital structure in the governmental system, in the de facto government, which is Hamas, in the civilian part of it, under the Minister of Health. Across the street was a field hospital. And the doctors in the governmental hospital, they were hardly paid any salaries because of the financial disastrous situation in the Ministry of Health. Whereas across the street, say they got $50 if they had payment per month. Across the street, they were offered $500. So where do you go if you have a family? You have a husband, you have a wife, you have 5 kids, you have 2 grandparents. Where do you go in that situation? Where, you know, the prices in Gaza were soaring up to the skies. Poverty is rampant, and they are going to work and at the same time try to get some income for the family. Of course, it's easy to say yes to that nice offer, to go across the street to that international field hospital and have $500 paid per month, because Minister of Health didn't even manage to pay them every month. So just that illustration, in a way, can give us a picture of how a combination of brain drain and fatiguing the official healthcare system through setting up parallel structures that have abundant with money and resources, but do not belong to the native healthcare system, and it's only temporarily, and also use resources that should have been used to immediately repair, restore, and reopen the Palestinian hospitals and provide a decent salary for the doctors, the midwives, the nurses, the paramedics. So everything hangs together here. So we criticize that in this paper, and I urge people to read it, because a few years ago I coined the term evidence-based solidarity. You know, in medicine, we are supposed to do evidence-based praxis, meaning that we should only provide treatment that has solid evidence in the research literature, in clinical research, in double-blind randomized studies to see if treatment really has effects. So evidence-based is the slogan of modern medicine. And when I say evidence-based solidarity, I think that all of us are around the globe who take part in the massive solidarity movement for Palestine, we need to study more. We need to go deeper. We need to know the numbers. We need to be able to rebuff the lies and the propaganda from the Hashpara. And we need to do our own studies. So this paper, I recommend it. I hope you can have the reference somewhere in the video.
We will link it, of course.
The second paper is another one that we just published in the Lancet, which is about trauma care in Nasser Hospital, 13 pages, where we did something very innovative with the young doctors in Nasser who were stuck with extremely serious war trauma and not much clinical experience. So we gathered a system with 100 top-notch clinical experts from around the world who were available in a sort of a call system. So when they had a case in Nasser Hospital, they could call and we could provide the right expertise. They would send whatever they had of pictures and x-rays and small movie clips, small videos. And then they will be guided hands-on through video in the surgery or in the treatment modality. And we described that in this paper. This is from Lancet just recently. And the last paper I just take as an example is also from the Lancet, not very much reported. This was published the 23rd of January this year. And this is a group of researchers who have looked at life expectancy in Gaza. I don't know if you know the result. It's really shocking. You know that the life expectancy, you know, how long are you expected to live on an average when you're born? It has dropped by 34.9 years within 12 months. Can you imagine? Okay. The occupation, the bombing, the starvation, the disease, the siege of Gaza has had such a dramatic effect on public health that you will lose 35 years of your life. And this is the indirect effect of the ethnic cleansing and the collective punishment. And I would say it is a dramatic illustration of the genocide, in addition to the mere killing. So this, again, this is Lancet. So evidence-based solidarity, my friends, all around. Study more, follow, read, be the expert on what the colonial forces are doing. And in particular now, when we have all this, you know, horrible initiatives or whatever we should call it, the stealing of Gaza by the Americans, suggested by President Trump. And we have this very strong focus on Ukraine and the dealing between Russia and US. We must not lose focus on Gaza and the West Bank, because what goes on in Gaza has been going on in Gaza, is now going on in the West Bank, and the attacks on healthcare are just the same as in Gaza.
I don't want to take much more of your time, Dr. Gilbert, but a couple of things I want to say. Number one is that we are going to be linking to all these studies and papers in all of our platforms. And of course, we'll be writing about this the Palestine Chronicle and other newspapers. And we are going to highlight the concept of the evidence-based solidarity. It's an absolutely brilliant way of putting it. One just very, very quick follow-up, and if you don't mind, a quick answer as well. You know, we have friends in a certain country in the Middle East, and they were in the process of preparing a field hospital, and they were, you know, just ready to go to Gaza and to build this field hospital, and we know that they are well-intentioned. But now, what you're saying, are you essentially saying, don't do that, direct these resources and energies to an existing medical infrastructure under the leadership of Palestinians in Gaza? Is this essentially what you're saying?
What I am saying is that that question should be answered by Dr. Youssef Abarish and his staff.
Mhm.
And this is to decolonize our thinking. Why if somebody came to Norway, if we had a massive avalanche, snow avalanche, we have a lot of that, and they came from Saudi Arabia and landed in our airport and came with some field hospitals that we never asked for and set them up, we would say, go away. We are in control. So I would politely suggest that they ask Dr. Youssef Abarish and his staff. It's well organized. They have been massively efficient through these 15 months. I know him personally. He is one of the best leaders I know in the world today. So ask them. Maybe they want a field hospital. If they want it, they should direct it to where it should be put up. And they should maybe even consider the people who provide the field hospital, how they will arrange with the wages for those who are going to work there. Of course, it's always nice to see the picture of a clever expert in pediatric surgery doing some complicated surgery on a child, coming from outside and doing it, and everybody's holding up the child, and it's very nice, and they're rescued. But that again blurs the most important picture, which is the picture of an extremely brave healthcare sector with Palestinians, and they are doing 99% of the clinical work. It's not we white to do it. It is the Palestinian system, and it's been like that all these 15 months. It's been like that for the 25 years I've been in Gaza. And yet we have not been able to convert the NGO efforts into sustainable ways of really supporting Palestinian healthcare proper. And we should be very careful not to create Gaza and the West Bank as a donor-dependent society like Afghanistan, because that is, again, another way of colonizing the global South. Absolutely. It is to infuse all this well-willing, almost unarguably good projects, but they may not be good at all. They may be counterproductive in the long term. And my simple answer to your question is ask the Palestinians.
Romana,
and respect their answer. And maybe if you had $2 million, maybe those $2 million would be better used to pay wages for the healthcare workers in Gaza, the Palestinians, who have been starved on both wages and food for 15 months.
Thank you for that. And Romana, your chance at one last and very quick question, so Dr. Gilbert can get back to his work.
Yes, really very quickly. Of course, it's very clear the role that the international community should have, because they tend to replace, as you said, in a colonial way, but they don't endorse their responsibilities. Really, very briefly, what are the responsibilities of the international community amid this horrific Israeli genocide?
Well, it's massive. It's massive. I mean, we know from minute to minute what's going on. We see it on our screens. We can. I mean, if you're on whatever platform, on X or on Twitter X, or you are on Instagram or whatever, or you follow Electronic Intifada, brilliant, or Al Jazeera Arabiya, or Al Jazeera English, or TRT English, we know everything. The Western governments have known this all the time now for 15 months. And the responsibility is, of course, to uphold international law, similarly powerful for white, brown, black, and yellow people. And I think we need to realize that the world, the powers of the world, would never, ever have accepted that 17,000 Jewish Israeli children had been killed in Haifa and in Tel Aviv under a siege of Israel, or would never, ever have accepted that 1,000 Israeli healthcare workers were killed by some enemy attacking Israel, or accept that 18 out of 36 hospitals have been closed down due to attacks. So this double standard is horrific. And international law, either it applies to everyone or it applies to no one. And we are on the way back to the law of the jungle. That's not very original to say. But if might defines right, then to the extent that there is a world order, that will collapse. And I'm very scared for my children and my grandchildren that we are entering now into a new neo-colonial era with Bush, with Putin, with the big powers, and with Netanyahu and his fascist government, that they are allowed to do anything without sanctions. So I'm extremely happy that South Africa have taken Israel to the International Court of Justice. I'm happy for the ICC's arrest order. But I think we need to step up our demands on our governments for them to say stop to the United States and to Israel. My government have been critical of Israel, but they have not at all been critical of the United States' supply of arms and money to Israel. So the US government have been exempted from the criticism that the Israeli government has got. And we need to see the connections. And one final quote, Samora Machel, the first president in the Free Mozambique Republic, a guerrilla fighter and commander, he said, solidarity is not an act of charity. It is an act of unity between people fighting on different grounds towards the same goals. The struggle the Palestinians are fighting for their humanity, for their freedom, and against occupation is actually a struggle for my children and my grandchildren and our freedom. My struggle in Norway is a struggle for the Palestinian people and the children and the women and the civilians and all the people of occupied Palestine. So this distinction between charity and solidarity is so important, because within solidarity concept, we are fighting together towards the same goals: freedom, equality, no racism, no occupation, and no colonialism. Solidarity is not an act of charity, it is an act of unity between people fighting on different grounds towards the same goals. And if you want to read a good book on charity, this book, Against Charity, a brilliant book by Raventos and Wark, which covers the essence of the debate on the problems with charity.
Thank you so much.
Dr. Mads Gilbert, thank you very much for your insight, for your compassion. But I feel like we've raised really more questions for future discussions and debates than we answered, because this was very, very compelling indeed, and very courageous in many ways. But we are used to the courageous Dr. Gilbert in everything he does. To our viewers and listeners, thank you for tuning in. Remember to share, like, and interact with our content, and to do everything in your power to spread the word. From me, Ramzy Baroud, and my co-host, Romana Rubeo, see you next time.
Shukran jazilan.
Thank you.